Hi there, my name is Briana and I'm a registered dietitian nutritionist here at Torrance Memorial. As you prepare to begin oncology treatments, we here at Torrance Memorial and the Hunt Cancer Center want to make sure you feel prepared and supported throughout your entire treatment schedule. Depending on the type of treatment you'll be receiving, there are several different side effects you may experience. Today, I'm going to walk you through some of the most common side effects and how you can use nutrition to help manage them. Let's get started. Some of the most common side effects experienced by patients undergoing chemotherapy and radiation treatments include altered taste buds and food aversions, mouth sores and mouth pain, nausea and vomiting, diarrhea and constipation, fatigue, and weight loss. In this video, I'll discuss how to approach each of these side effects with nutrition and review some recipes to help you apply all of these suggestions. The first side effect we'll discuss today is altered taste buds and food aversions. Depending on the medications and treatments you're receiving, you may notice foods taste different than they used to, or you may not have a desire to eat foods you used to crave. If food tastes bland, there are a few things you can do to add more flavor. You can season with spices and fresh herbs such as lemon, garlic, cayenne, turmeric, rosemary, basil, oregano, or even use warm spices like cinnamon, nutmeg, and ginger. Try marinating meat and vegetables in a simple fruit juice, wine, vinaigrette, or salad dressing to boost flavor. And drinking tart foods and drinks like citrus, fruit juice, and smoothies can also add more variety to your diet, or eating foods with stronger flavors like your favorite nut butter. Lastly, try adding a natural sweetener like honey, maple syrup, or agave. If food tastes too sweet, try adding tart flavors to your meals, such as citrus fruit, vinegar, and pickled foods. But make sure to avoid these foods if you have mouth sores, which we'll discuss in more detail later in this video. If food tastes sour, try adding sweet flavors such as ripened fruit, honey, maple syrup, and agave. If food tastes metallic, there are a few things you can do to help offset the taste. Mints, candies, gum, and citrus fruit all help reset your palate with refreshing flavors. Avoid metal utensils and cookware. Instead, opt for plastic utensils and ceramic or glass baking dishes. And lastly, brush your teeth and rinse your mouth regularly to help remove unwanted tastes. So now that we have this information about potential taste bud changes and aversions, how do we incorporate it into our diets? Here are just a few simple recipes you can try that incorporate all of the tips we discussed. Warm cereal is one of my favorite comfort foods that can be easily modified and adapted to meet all of your taste preferences. You can use any grain you like: oats, 7-grain mix, steel-cut oats, cream of wheat. Add fresh fruit or dried fruit for some sweetness, a dollop of nut butter or yogurt for protein and healthy fats, and top it with your favorite granola or a handful of nuts for some extra crunch. Hummus is another great snack that contains fiber, protein, and fat. The strong flavors from tahini and chickpeas help offset any taste bud changes you may be experiencing. Serve it with a side of vegetables or your favorite crackers or bread, and you have a nutritious and filling snack. Vegetable soups are a great way to incorporate vitamins and nutrients into a comforting meal. Simply take your favorite vegetables, cook them in a broth or cream base, and puree it to your desired consistency. You can mix up the spices and vegetable combinations to your preferences. Soups are also a great source of hydration. Speaking of hydration, another common side effect is a decreased desire to drink water. If water is unappealing, try drinking an alternative fluid drink such as tea, milk, non-dairy milk, or a sports electrolyte drink. And don't forget, fruits and vegetables also contain a lot of water. By eating a variety of fresh or frozen fruits and vegetables, you're also providing your body with extra hydration. Your doctor or dietitian may also suggest trying an oral nutrition supplement, which is formulated to provide additional calories, protein, and vitamins in each shake. One of my favorite ways to dress up water is by making infused water. Take your favorite fresh or frozen fruits and combine them with different herbs and citrus, and put them in your water for a refreshing new flavor combination. You can even purchase water bottles specifically designed for infusing water. Another common side effect of cancer treatment is aversions to smell. If this happens to you, try to avoid consuming any foods with smells that bother you, or keep them in a separate compartment of your refrigerator if possible. You can also reduce food smells by serving food at room temperature. Foods that are warm tend to have a stronger scent. Try keeping food covered when not being eaten or drinking liquids out of a cup with a lid and straw. When weather is appropriate, try cooking outdoors or keeping the windows open when cooking indoors to help ventilate your living and dining space. Certain cancer treatments may cause mouth sores and mouth discomfort or pain. If this happens to you, avoid eating acidic or spicy foods, as these can aggravate your mouth sores even more. Eat moist, soft, and bland foods to prevent further irritation. Room temperature or cold foods, such as popsicles and smoothies, can also provide relief. Smooth, moist textures are usually better tolerated. Try using a blender or food processor to make purees. Add butter, sauces, cream, broth, oil, or even avocado to provide additional moisture and calories. One of my favorite ways to incorporate these strategies is by making popsicles. You can purchase popsicle molds or use a paper cup with a popsicle stick. All you need is your favorite fruits, yogurt, or liquid. Here are 2 of my favorite recipes that incorporate fruit, protein, and even some vegetables. One of the most common side effects experienced by oncology patients undergoing treatments is nausea and vomiting. It's difficult to eat when you're feeling sick, so here are some strategies to help. First, avoid foods and drinks with smells that bother you. Avoid high-fat, greasy, spicy, or overly sweet foods, as those can sometimes exacerbate your symptoms. Instead, stick to bland, dry carbohydrate foods like toast, crackers, oatmeal, or pasta. Comfort foods like mashed potatoes or vegetable soups usually fit this description. Try to drink beverages between meals rather than with meals. This will help prevent you from feeling too full to eat food. And if eating large portions of food feels challenging, try eating 5 to 6 smaller meals throughout the day. Always eat sitting upright and avoid laying down right after eating, no matter how tempted you may be. This will allow gravity to naturally help keep food down. Ginger is anecdotally known to help with nausea. Try drinking ginger tea or ginger ale. If your nausea has progressed to vomiting, here are a few more strategies you can incorporate. It may be tempting to try and eat or drink after vomiting to replenish your body, but avoid eating or drinking right away. Instead, wait around 30 minutes until the vomiting has subsided and slowly incorporate fluids and soft, bland foods into your diet. This recipe for golden milk popsicles is one of my favorites. It incorporates several of the tips we've talked about so far today. The cold temperature can be soothing for nausea or taste aversions. It also incorporates ginger and cinnamon for additional flavor. And the Greek yogurt provides calories and protein to sustain your energy levels. Best of all, these can be made ahead of time, so you can keep them on hand for whenever you need them. Staying within the GI tract, our next set of symptoms are diarrhea and constipation. Both are commonly experienced by oncology patients. First up, diarrhea. If you're experiencing diarrhea or loose, watery stools, you're at risk for dehydration, so it's important to drink plenty of fluids. Eat small amounts of soft, bland foods, such as those found on the BRAT diet. BRAT stands for bananas, rice, applesauce, and toast. These are low-fiber foods that can help bind your stool and slow down diarrhea. Avoid eating high-fiber foods like raw fruits and vegetables and whole grains, as these can exacerbate diarrhea. Eat small portions throughout the day to minimize volume. And lastly, try an anti-diarrheal medicine if prescribed by your doctor. This recipe for banana cauliflower bread incorporates bananas, white flour, and cauliflower, which are all starchy and low fiber to help prevent diarrhea. It also provides a small amount of protein from the eggs and potassium and vitamin C from the bananas and cauliflower. Some patients may experience constipation instead, or their bowel movements may fluctuate between diarrhea and constipation. If you're experiencing constipation, it's important to stay hydrated and drink fluids throughout the day to help keep your digestive system moving. Remember when we talked about fiber during the previous slide? With constipation, it's important to eat fiber. Increase your intake of fresh fruits and vegetables and whole grains. Another way to get your bowels moving is to increase your physical activity. If you have the energy, try taking a short walk outside or around your home. Every step counts. Eating at regular meal times can also help your bowels adjust to a more regular schedule. Your doctor can also provide you with a more individualized bowel regimen if additional medications are needed. This recipe for lentil soup provides lots of fibers from the vegetables and lentils. The addition of broth or cream also adds additional fluid, which helps with hydration. Cancer treatments can take a toll on your body. Patients often report feeling tired and fatigued, which can make it really difficult to eat adequately. As I've mentioned before, it's important to stay hydrated and drink plenty of fluids. Dehydration can often cause feelings of lethargy. Don't forget, fluids come in many forms: water, juice, sports drinks, broth, tea, soups, and fruits and vegetables all provide hydration. Try preparing food when you feel your best, or asking friends or family to help with meal preparation. When any of these side effects are present, they're often followed by weight loss. Maintaining your weight and avoiding weight loss during cancer treatments can help keep your body strong and energized. To prevent weight loss, it's important to eat adequate calories. Aim to incorporate more high-calorie foods like nuts and nut butters, full-fat dairy, avocado, oil, butter, salad dressings, and sauces. It may sound simple, but eat when you're hungry. Don't skip meals. Instead, take advantage of moments when your appetite is stronger and feed your body the food it needs. Eat smaller, more frequent meals, or add snacks between meals to maintain your calorie and protein intake throughout the day. Lastly, preparation is key. Have a variety of ready-to-eat meals in your freezer and snacks on hand for those moments when your appetite is present. This recipe for avocado macaroni and cheese provides a twist on a classic favorite. This dish is rich in heart-healthy fats and calories from the avocados, butter, and whole milk. It's perfect for sneaking in extra calories to prevent weight loss. Now that we've covered the common side effects and how to manage them with nutrition, here are your nutrition quick tips. Number 1, eat 5 or 6 small meals per day. This can help with nausea, prevents you from feeling overly full, and can regulate your bowel movements. Number 2, eat the largest meal when you are the hungriest to help optimize your nutrition intake and prevent weight loss. Number 3, start with high protein foods when you have an appetite to help with your calorie intake and prevent muscle wasting. Number 4, to help keep you nourished during those days when you don't have the energy to prepare a meal, keep your favorite high-calorie foods and beverages within reach. Number 5, incorporate physical activity and get your body moving whenever you have the chance. This helps regulate bowel movements and can stimulate your appetite. Remember, daily activities around your home and going for a walk outside both count as physical activity. 6, reach for help whenever you need. Going through cancer treatments can take a toll on your body. Use your community of friends, family, or support team here at Torrance Memorial to help you navigate treatment side effects. Number 7, if you need additional help, our outpatient nutrition department is always here to provide additional guidance and support. If you have any further questions or would like a more personalized approach for your diet and nutrition, our team of registered dietitian nutritionists here at Torrance Memorial is always available to provide additional support. For more information, you can find us at the number and website below. Thank you for joining me today. I hope the information in this presentation provides you with knowledge, confidence, and comfort as you navigate your personalized treatment regimen.